So this event is part of the objective that we have is to get the Namibian name out there, to inform the global world as well as our locals that the Namibian doctors and just the members of the healthcare are busy. We are busy trying to improve the quality of care, and we are actively busy trying to get new ideas as well as innovations to do so. Another objective is also to provide evidence-based medicine as well as information. There's a lot of research being done in the country, and we just want to provide a platform for people to share this information. Additionally, it is for our members, who are mostly doctors, to network and to gain professional development skills, as well as to update their knowledge on what is the latest that's happening in the field.
Mm-hmm. Now, this year's theme is titled Intersecting Frontiers, Advancing Global Healthcare Through Research, Economics and Technology. What exactly is meant behind this theme?
When we look at healthcare is global. Something that affects one person in a part of the world has implications to the rest of the world as well. So we have to always be up to date as to what is happening in the global world when it comes to to healthcare. And so we want we wanted the theme to be focused on to Namibia as part of the global village. Additionally, research is actually what drives the medical practice. So we have to understand what is our populations. We have to understand why are the things, the diseases that affect us, and also how are the responses that people usually have. So research is a key focus into driving the understanding of global healthcare. And additionally, we can't do anything without finances. So understanding the economics of a country, the economics of a system is fundamental to, again, improving and understanding how to provide efficiency in the health system. And then obviously technology. Currently the world is at a place of technology advancement. Namibia wants to be part of that. We want the healthcare sector wants to be part of that, and we want to see what can we as Namibians actually contribute to the technological advancements in healthcare.
How are the different stakeholders expected to collaborate in the advancement of global healthcare through research, economics, as well as technology?
Everybody has a part to play. We have the clinicians who are, again, majority of our members, we have the doctors who are on the floor doing the work, but we also have the people who are financing. So it's to link the clinicians with the colleagues who are financing, which are the medical aids, which are then the government who funds the public healthcare, as well as members of our sponsors, which we are very grateful for, who are silent contributors to the healthcare. Additionally, we also have the researchers. Again, so much scientific work is being done. So we want to link the different people who are doing researches in different parts of the country with each other, as well as the world. We are going to have lots of speakers from the international world as well, and to have an access for collaboration, for cooperation, and then to improve the innovation that possibly can come from this Congress. Additionally, we're also looking at just ways to improve what we have currently, to learn from each other. So there are colleagues who are experts in the field, who've been in the field for a long time, and then we also have the junior guys who are starting and who are entering the field, and just to help them, to sort of show them who are the guys to link up to mentorship opportunities, and just to give them opportunities to where are we headed as a fraternity, and what are the opportunities that are out there for them.
So, Doctor, can you talk more about the notable resolutions that you have brought forward from the previous conference that you can highlight, perhaps?
Yes, we had one in November 2023, very, very successful. That one was specifically focused on the economics of the healthcare. So we are specifically focused on the funders, which in our system is the medical aids as well as the government for the public service. We have formed quite good collaborative. Just to start off, it was an opportunity for our members to just hear from the funders, to hear from them what are their plans, what are their strategic plans, what are their shortcomings in their pitfalls, where do they need us as clinicians to assist or to understand them and what their perspective. So after that, there has been quite a lot of more sessions of collaboration, strategizing, forming small teams. I know with the Namibian Medical Aid Association Fund, they actually have working now towards strategizing and forming small collaborators with the stakeholders, which are the clinicians and obviously other members as well. Then with the Ministry of Health, this is actually the first one that is co-hosted with the ministry. Usually we do this on our own, but the Ministry of Health through this since last year's AGM, we've actually had regular meetings with them, updates with them, and they have felt that what they're doing is actually quite needed for not just the doctors but also for other healthcare members, and that is one of the resolutions that they've had from last time. Additionally, our members have had regular CPD events, which is what is required as a professional to grow. You are required to update your professional development, and again, since the last Congress, we've had a regular event, and also we've had opportunities to negotiate and to negotiate with the minister as well as Ministry of the Prime Minister's office, and just on how the remunerations work and how to better gain remuneration packages for our members who again are the clinicians.
Perhaps what would you highlight as some of the most major challenges that you are facing in the health sector?
Well, like I said, research is what drives medical practice, and currently we are struggling as a country with clinical research, and this is research that understands the patients that we look after, understanding who are our patients, why do they get the diseases that they get, how are their lives affected by the diseases that they have, and then also, again, with the management options that we have, how do they respond to the management that we give them, and what are some of the challenges that they come about because of this management that we give them. So again, clinical research in the country is one of our current shortcomings, and it's also why we really want to push it at the Congress. We are going to have a conference workshop on research to just try to get our clinicians again to understand that it is important, we need to get involved, and just what are sort of the pillars that can assist us in getting involved. Additionally, we also have challenges in economics. The medical aids are currently struggling. We have an issue of employment. I think yesterday's newspapers also today had something about retrenchment, people being retrenched. So every time somebody is retrenched, that is a member of a medical aid potentially that is lost. So medical aids obviously work with a group funding. So when people are not having employment, that affects the provision of health resources. Additionally, also the public health sector, obviously funding there continues to be a problem. We have shortage of medications, like overcrowding, the need of more hospitals. I do want to applaud the government with the building the new district hospital in Kumas, but this kind of stuff still continue to be a hindrance in the provision of care for our patients. And obviously the disparity between patients in the state practice as well as those ones in the private practice, and just that difference in care. And we think that as a society, that's not something that we really would like to see in the country. We want equality, quality health care for everybody, and everybody to be receiving health care equally. So those are some of the challenges that we are currently facing. And additionally, also when it comes to collaboration, people often think that only some people need to be involved in these things, but COVID has taught us that we all have to speak up, we all have to be involved, and we all have to really play our part. One of the problems that we had with this conference when it comes to funding and some of the sponsors, and just, we really are appreciative of the guys who are on board. We really are appreciative of the sponsors that have come on board. But again, collaboration within the different sectors continues to be a problem, and again, not enough is being done in that state. And again, unemployment is a big challenge we have, whether it's it's regards to the medical aid or with regards to state practice. If somebody is unemployed, that affects their health-seeking behavior. It affects their access to care. It affects their retention if they're diagnosed with a disease. It affects their retention and health. It affects their response to the medication. So unemployment continues to actually affect, continues to be a major effect on the profession as well as to the healthcare services we are able to provide.